I'm Dr. Colin Santongo, and I am Chief of the Anesthesia Department here in Kemptville District Hospital. Likely you are watching this video as you are probably scheduled to have surgery with us in the near future. The goal of this video is to provide you with as much information as possible to help you prepare for your surgery. Having surgery can be a stressful experience, and hopefully by the end of this video you will be more at ease about your upcoming procedure. So, preparing for surgery means two main things. It means taking care of your health and learning as much as possible about the surgery from your anesthetist, the nurses who will be taking care of you, and obviously your surgeon. If you have a few weeks or even a few months before your surgery, try to prepare your body for the upcoming procedure. Try to eat more healthy foods and lose some weight. These two simple things will allow you to get through your surgery much easier. Patients always ask me about alcohol. A normal amount of alcohol would be maybe 1 to 2 drinks per day. If, for instance, you drink more than this, try and cut your consumption down to at least that 1 to 2 drink per day. This will prevent you from going into alcohol withdrawal. Improving your fitness level will also allow you to recover faster from your surgery. I'm not in any way suggesting that you spend hours in the gym, but simply increasing your activity to walking 15 to 30 minutes per day goes a long way in preparing your body for surgery. With regards to smoking, smoking and surgery are not a good combination. Not only can smoking lead to complications under anesthetic, but it also adversely affects wound healing. If you cannot stop smoking completely, at least try to cut down as much as you possibly can prior to your surgery. When I refer to smoking, this includes things like cannabis, tobacco, and even vaping. Speak to your family doctor about the possibility of starting the nicotine patch or lozenges or even gum. Additionally, try to avoid catching any infections prior to your surgery. You should do the usual things like washing your hands, avoiding sick people, and informing your surgeon if you become ill. Unfortunately, we are filming this video during the COVID pandemic. As such, we have had to take extra precautions to protect you and the staff. The hospital will contact you prior to your surgery and do what we call a COVID screening. This is to ensure that you're not ill. We will also repeat the COVID screening on the actual day of the surgery. Try to self-isolate 2 weeks prior to your surgery, as there's an abundance of evidence out there that has shown that contracting COVID and having surgery has led to worse outcomes. Please see the public health guidelines with regards to tips that they have available with regards to self-isolation. So your big day arrives and you're curious about where you'll be going. So come with me and I'll give you a tour. On the day of the surgery, you will come through the emergency entrance and be greeted by a screener. They will then direct you to the elevators which will take you to the second floor. The elevator doors will open up right in front of the surgical care suite. Once you pass through the doors, you will be greeted by the preoperative nurses who will take your information and direct you to a bed where you'll be given a gown. An IV will be inserted and your vital signs will be checked by the nurses. Prior to moving you to the OR, you will speak to the anesthetist and the surgeon will come by and mark his initials on your limb. It is expected that before your surgery, you will have lots and lots of questions. Questions with regards to what time is your surgery, how to manage your medications, what type of anesthetic you might receive. Don't worry, all these questions will be answered. Your surgeon will likely contact you if they have determined that you don't need a preoperative visit. And you will be asked to also complete an online questionnaire on the Kemptville District Hospital website. Please note, it is pretty important that you fill out this questionnaire, as it is very useful for your anesthetist when preparing your preoperative anesthesia clinic visit. Be rest assured, all patients will speak to their anesthesiologist. Some on the day of the surgery, and others a few days or weeks prior to the surgery. If your health history is straightforward, you will not be required to attend the anesthesia preoperative clinic, and your surgeon will let you know what medications you need to stop and start. If for some reason it is deemed that you need to attend the clinic, your anesthetist will be present on that day, and they will give you advice as far as stopping and starting your medications. When you actually see us in the clinic, please ask as many questions as you need to. And please remember to bring your pills with you. It's not sufficient just to bring a list. We really need your pill bottles. The most common question in the preoperative clinic is, how long will I be here? For most patients, it is approximately 2 to 3 hours. Please understand that surgery can be unpredictable, but this is our best estimated guess. The other most common question asked is, what time will my surgery be? Now, this is a hard question to answer, as this is really dependent on the patients that are listed for that particular day. The more complicated patients are usually scheduled earlier in the day, and the least complicated later on during the day. The hospital will let you know at least 3 days prior to your surgery, letting you know exactly what time to arrive. Now, on the day of the surgery, please bring all your medications, a CPAP machine if you use one, music to listen to with earphones, or a book to read. The night before your surgery, stop eating all solids prior to midnight. After midnight, you may drink clear fluids up until 4 hours prior to your surgery. Clear liquids includes things like water, ginger ale, or apple juice. As long as you can hold a glass up to a light and see through it, this is considered a clear fluid.
Hi, I'm Dr. Chris Kirby, and I'm one of the anesthetists who work here at Kemptville District Hospital. Prior to or on the day of your surgery, you'll have the opportunity to speak with your anesthesia team. We will discuss with you the multiple anesthetic choices appropriate for your surgery. Let's take a minute to briefly go over some of these options. Firstly, there's what is known as a general anesthetic, or GA. This type of anesthetic involves the use of a specific cocktail of medications to induce a state of deep sleep. Some of these medications may impact your breathing, and once deeply asleep, a small tube needs to be placed in your airway to assist you in breathing. Brief use of a ventilator is typically required. Grogginess and nausea are common ill effects after a GA, but these can be minimized by making small adjustments and taking an individualized approach to your anesthetic. A second popular option for procedures below the navel is a spinal anesthetic. A spinal anesthetic would be the typical technique used for total hip and knee replacements. This involves a small volume of local anesthetic introduced into the soft tissues of your back to numb your lower half. Most people opt to receive some sedative medications in their IV in addition to the spinal to send them to sleep, but you may choose to be awake if you so desire. If so, feel free to bring your own music and to listen to during the surgery. If you're having a colonoscopy or a gastroscopy, anesthetists will be on hand to provide sedation. Sedation is a shallower plane of sleep than a general anesthetic, whereby a ventilator or breathing tube is not necessary. Lastly, we could also recommend a nerve block, usually used for ACL surgery or shoulder surgery for pain control. We use an ultrasound to locate a nerve and surround it with long-acting local anesthetic. This provides excellent pain control during and after the surgery. Nerve blocks are often combined with IV medications to send you to sleep. It is important to know that your anesthetist will be present and vigilant at all times during your anesthetic. We continuously monitor your condition and work to ensure your safety and comfort. If this seems like information overload, don't worry. You'll have lots of time to speak with your care team to decide what constitutes the best option for your unique situation.
Hello, I am Dr. Steve Oliver. I am Chief of Surgery in Kemptville District Hospital. When you arrive in the OR, you will be greeted by the rest of the OR team, and you will have already met the anesthetist and the surgeon. We will initially hook you up to a blood pressure monitor, a heart monitor, and an oxygen monitor. The team will then gather around you and do the surgical safety pause, which is a pre-flight checklist to ensure that everyone involved in your care is in the same page as far as the appropriate plan for you. You will be involved in the surgical checklist and have the opportunity to ask any questions. You will notice during your time here that everyone will ask you the same questions over and over again. Please bear with us, as safety is paramount and each member of the team needs to hear the answers directly from you. We need to check and double check that everyone is on the same page. It is our goal to make sure your surgery goes as smoothly and as safely as possible.
Hello, I'm Dana Sands, and I'm one of the nurses in the recovery room. After your surgery, the OR team will bring you to the recovery room. We will ensure that your pain is under control and stop any nausea and vomiting you may have. We will put oxygen on you and an oxygen monitor, as well as a blood pressure monitor. Once we have decided that you are ready to go home, we will call your family and let them know where to pick you up. If you're having surgery that requires staying overnight with us, nurses from the surgical ward will help transfer you and your belongings to your room. If you're going home on the day of your surgery, we will also give you specific discharge instructions unique to your specific surgery and a prescription for pain medication from your surgeon. Please discuss with your surgeon prior to your surgery what are the most appropriate pain medications for you. After any surgery or procedure, you cannot drive or drink alcohol for 24 hours. You will also need to have someone at home to take care of you on the first night of your surgery. The most common question we get asked is, when can I start eating again? We recommend a light meal as soon as you are able and to progress slowly back to your normal diet as you can tolerate.
Thank you for allowing us to walk you through your surgical day at Kemptville District Hospital.
We look forward to meeting you and getting you through your surgery as comfortably and as safely as possible. See you soon!